You're featured in the 2018 documentary The Game Changers, and in a much talked about part of the film, you use three collegiate athletes to demonstrate the impact of consuming one plant-based meal on erections. Can you tell our audience about that experiment?
Yes, that was a scene that almost didn't make the movie because I almost didn't do it because I didn't think it was going to work. I was approached by the filmmakers with the question, can we demonstrate a single meal effect on sexual function? And as a urologist practicing for several years, most of the men I treated for erectile dysfunction were older men, and we typically thought of erectile dysfunction when it wasn't a psychological condition as being a gradual onset of age related changes over time. And so I didn't think it was feasible that we would be able to demonstrate a single meal effect on erections. But the filmmakers really pushed and encouraged me to really reconsider and reconsider. And so finally, very close to when the film had to be submitted, I relented and agreed to try this experiment that we did in the movie. The way the experiment was constructed was that there is a device called a Rigiscan, which is put on a man's penis, two little rings, one at the base and one towards the end of the shaft, and they're constantly squeezing and unsqueezing and testing what the pressure is against them as they squeeze. And the more pressure they encounter, that means the more rigid the penis is becoming. So it's a way of telling if there's an erection happening or not and for how long it lasts. And this device records this information all night long, and the man wears it while he's asleep. And the reason that is because men can have psychological erectile dysfunction, and they may not be able to tell if that's a physical problem or a mental problem. But when a man's asleep and unconscious, if they're having normal erections, then that is a psychological problem during the day, but he doesn't really have a physical problem. So that's how this tool is used, is to distinguish. But what we did is we used it to see, okay, when a guy's asleep, unconscious, and there's no other factors affecting his erection except the fact that he's supposed to normally get some erections through the night, that's normal. Would we see a difference in those erections if he went to sleep after eating a plant based meal versus if he went to sleep after eating an animal based meal? And I knew that in order to measure a difference, we would want to have a biological system that was as healthy and responsive to changes as possible. We needed a biological system that was going to be very sensitive. And so that's why we had three young collegiate athletes. These are going to be men really in the prime of their health, with their bodies not yet ravaged by age related conditions. And these are men who have taken very, very good care of themselves, are not doing drugs, drinking alcohol. They're training at an elite level in their colleges. So these were the prime biological test units, if you will. And we gave them a meat based burrito for dinner, and then we strapped the devices on them, and they were monitored overnight as they slept back in their dorms. And then the next night, we gave them a plant based burrito. All the ingredients were the same, except we swapped out the meat portions, whether it was chicken, beef, or pork, for plant based meat substitutes. And then we measured them again. And I was absolutely blown away by the results. I couldn't believe the difference. I did not expect we would see any difference. And I told the
Mm.
filmmakers that, you're probably going to spend a lot of money bringing your team together, coming in here and filming this, and we're probably not going to see anything. And lo and behold, we saw a dramatic change. We saw 300 to 500% increase in the duration of the erections and the frequency of the erections while they were asleep, unconscious. So this was a biological, it was presumably a biological effect. Now the thing is, it's just three guys, and it's not a controlled study, and so I cannot draw any real scientific conclusions from this. But based on the experiment and how impressive that signal was, there is now a clinical trial occurring in New York City with medical students and they're enrolling about 30 plus medical students, and they're doing the same experiment, but they're prolonging it. They're checking not only one night, but also a night and a full day of meals on
Wow.
the results of the Regiscan. And that's going to be very exciting to see
Yeah.
what the actual data is. And again, we don't know if the actual data will reflect and reproduce what we saw in the movie, but we're doing the science now, and we will see.
When can we expect the results on that?
Well, it's already underway. Perhaps up to half of the subjects have enrolled and completed their tests. We won't be able to look at the results until the end because it's
Mhm.
blinded. And so I'm expecting perhaps we'll have data within a year.
Okay. That's going to
Yeah.
be exciting.